So we want to look at another foundation of x-rays. Not really only x-rays, in general radiography. So this is more of like pre-exposure instructions. So pre-exposure instruction, when you hear pre, something that is before, right? So these are the instructions that are meant to actually give to the patient before the imaging time. Okay, so pre-exposure instructions in radiography are just the steps that are taken before a patient is exposed to radiation. And you are trying to ensure that you are giving the right instructions to the patient so that they are safe, so that they are able to position themselves rightly so they can have the best imaging. So first is patient preparation. So you have to first verify the patient's identity and get to sign it that the patient you are dealing with is a patient that the medical provider was actually requesting for their image. So you also explain the procedure to them to reduce the anxiety and calm down the situation. You have to ensure that all those metallic objects, jewelries, clothing and all of that, they are removed, and you give them an imaging gown. Okay, so clinical and technical checks, you have to review what the doctor wants. You have to also still ask the patient 1 or 2 questions. Okay, then you select the best imaging modality for that. It could be film, it could be x-rays and all of that. It could be CT scans, could be MRIs, could be PET and the rest of it. So you have to make sure that you actually have the modality that is suitable for that, because if you don't have the modality, you could actually refer. So positioning and immobilization is, you have to actually make sure that the patient is standing or lying in a way that that part of the body that needs to be imaged, you actually get the best image for that. Okay, so radiation protection, this is when you can protect their genitals. This is when you collimate the x-ray beams, ensure that they have aprons, thyroid shields. Then equipment and exposure settings, you have to check the x-ray tube alignment, set the correct source to image distance, and ensure all those parameters that will get to determine how much of the exposure the patient is actually coming in contact with. So final check and readiness is, you have to confirm the patient comfort, recheck that they are still positioned like that, and ensure that everybody in the x-ray room is actually behind a protective barrier. Then you fire the rays. So these are the different things that you should actually put in consideration before the imaging time.